A new study finds a link between antidepressants and type 2 diabetes. Doctors are still working to figure out the exact link or cause here, but the potential risk is a cause for concern for millions of Americans who take the drugs. Erin Tolbert is an emergency room nurse practitioner and joins us now to talk about the study. Erin, thank you for your time today.
Hi, Shannon. Thanks for having me.
All right, so what can you tell us about this study? How worried should folks be? Because there are so many Americans who do take some form of antidepressant medication.
Well, essentially what this study tells us is that antidepressants and diabetes are linked, in that individuals on antidepressants have about a 60% higher risk of developing diabetes. What the study doesn't tell us is how and why. We don't know if diabetic individuals are more prone to developing depression or if the medicine is actually dangerous. And the reason this is so alarming is that an increasing number of Americans are taking antidepressant medications. Right now, about 1 in 10 Americans over the age of 12 takes these medications. So if they are actually dangerous, we have a big problem on our hands.
We do, but how would this work with the body chemistry, or what kinds of things can we determine from the study so far? I know that doctors are taking this now as a jumping off point to try to figure out more, but how would they be connected?
Well, obesity and depression obesity and diabetes are certainly connected. We know that obesity alters your body's ability to use insulin, which is important in diabetes. What we don't know right now is how antidepressants affect that chemistry. We don't know if they do make you more obese and that's why they're causing this problem, or if they're unrelated.
Okay, so if you you are on prescription medication for depression, what kinds of things does your doctor need to know? What kind of things do you need to discuss with them to see if you might be at some kind of increased risk for this particular complication?
I think this study is an important wake-up call both for doctors, nurse practitioners, and patients. If you're a patient, you need to talk to your doctor about any family risks that you have. Do you have other family members with diabetes? Are you obese? Is your lifestyle sedentary? Are you prone to developing this condition already? If you are, then being on antidepressant medicines might not be the right thing for you. For your doctor, what this study means is that if you walk in and ask for an antidepressant medicine by name, they shouldn't just blindly prescribe it and send you out the door. You always need to weigh risk versus benefit with any medicine and consider if the potential side effects outweigh the risk of any, or the potential benefits outweigh the risk of any side effects.
So the message here for folks, as we know millions of Americans are taking this medication, what is the message to them? Not to panic, that they shouldn't be worried. They hear about this study. For a lot of people, that medication is necessary for them to cope. And it would be the wrong assumption, I'm guessing, for them to immediately say, I don't want to have the risk of diabetes. Maybe somebody in my family has it. I'm going to stop taking my medication.
You're certainly correct. Stopping antidepressant medicines can actually be quite dangerous. If you're concerned about this study, you really need to talk to your healthcare provider. If you do decide to stop the medications, typically what they do is taper off the dose. Just quitting taking your medications is actually going to be more dangerous than the risk of diabetes. If you are feeling...
No, go right ahead.
If you are feeling depressed or think that you do need an antidepressant medicine, it's important to talk extensively with your doctor and sort of weigh your personal habits, your medical history with the benefit of that medicine.
All right. Well, a lot for folks to talk about with their doctor anytime they're on any of these medication, and certainly, as you said, weighing the benefits against any potential complications, very, very important. Erin, thank you very much.
Thank you, Shannon.